The kidneys are the body's ultimate filtration and balance system. When acute kidney injury occurs, there is a sudden, rapid loss of kidney function. To master this for the exam, you must categorize the why into 3 distinct areas. Prerenal, the problem is before the kidney. This is a perfusion issue. If the heart isn't pumping enough blood or the patient is severely dehydrated or bleeding, the kidneys don't get the pressure they need to filter. Intrarenal, the problem is inside the kidney. This is direct damage to the nephrons. This is often caused by nephrotoxic medications like Aminoglycoside antibiotics or Non-Steroidal Anti-Inflammatory Drugs, or contrast dye from imaging. Postrenal, the problem is after the kidney. This is an obstruction. If a kidney stone or an enlarged prostate prevents urine from leaving the body, the back pressure damages the kidney tissue. When the kidneys fail, waste products like blood urea nitrogen and creatinine build up in the blood. More importantly, the kidneys stop excreting potassium, leading to life-threatening cardiac arrhythmias. Science Pearl number 1. The creatinine gold standard. While blood urea nitrogen can be elevated by dehydration or a high-protein diet, creatinine is the most specific indicator of kidney function. If the creatinine is rising, the filter is failing. Science Pearl number 2. The oliguric phase. In the early stage of injury, the patient may produce less than 400 milliliters of urine in 24 hours. Your priority here is monitoring for fluid volume overload and hyperkalemia. High potassium. Let's do our renal mastery quiz. 1. A patient is admitted with a severe hemorrhage after a motor vehicle accident. Which type of acute kidney injury is this patient at greatest risk for? Answer: prerenal injury. Rationale: hemorrhage leads to hypovolemia, low blood volume, which decreases the blood pressure and flow to the kidneys, preventing filtration. 2. A nurse is reviewing labs for a patient receiving gentamicin, an antibiotic. Which value is the most important to monitor for medication safety? Answer: serum creatinine. Rationale: gentamicin is known to be nephrotoxic. An increasing creatinine level indicates that the medication is causing intrarenal damage. 3. What is the primary cardiac risk for a patient in the oliguric phase of kidney injury? Answer: hyperkalemia leading to lethal arrhythmias. Rationale: because the kidneys are not producing urine, they cannot excrete potassium. High levels of potassium can cause the heart to stop. 4. A patient with an enlarged prostate is unable to void, and their creatinine is rising. How would the nurse categorize this injury? Answer: postrenal injury. Rationale: the obstruction in the urinary tract creates back pressure that prevents the kidneys from functioning properly. 5. During the diuretic phase of recovery, what is the nurse's primary assessment priority? Answer: monitoring for dehydration and electrolyte depletion. Rationale: as the kidneys begin to work again, they often dump massive amounts of fluid and electrolytes before they regain the ability to concentrate urine. Section 3. Clinical case study, the contrast crisis. The scenario: you are caring for Mr. Hayes, who just returned from a computed tomography scan with intravenous contrast dye. He has a history of mild chronic kidney disease. Applied physiology: contrast dye is highly osmotic and can be toxic to the delicate tubules of the kidney. You notice his urine output has dropped to only 20 milliliters per hour over the last 3 hours. The nursing action: you recognize this as a potential intrarenal injury. You immediately notify the provider of the low urine output. You anticipate an order for a normal saline bolus to help flush the dye through the kidneys. You monitor his serum potassium levels closely to ensure he isn't becoming hyperkalemic. The result: by catching the drop in urine output early and advocating for aggressive hydration, you helped Mr. Hayes avoid permanent kidney damage. Hopefully that's a fresh one for your records. You are doing an incredible job building this clinical foundation. If you want to dive deeper into these high-stakes scenarios and ensure you're ready for the boards, join us at nurselearn.co. We specialize in the critical thinking that turns students into licensed professionals. Plus, we offer Afterpay so you can invest in your nursing career today and pay as you go.